from arthritis and spinal stenosis. And this is a very popular topic because many people suffer from arthritis, especially osteoarthritis, and have spinal stenosis, where the canal that has the spinal cord or the nerve roots coming through is narrowed. And that's affecting the patient's ability or the person's ability to move, to do their normal routine. And it can cause quite a bit of pain and discomfort, muscle spasm, and all the different reactions to stenosis and arthritis. So we're going to talk more about that today. Thank you for joining me. And I'm just going to share my slide with you and we can get started. So again, my name is Dr. Kerry Yerkew. I'm a chiropractor here in Kelowna, British Columbia. I've practiced for over 25 years and I've seen thousands of patients, over 10,000 patients now in my career. Many of the patients have had degeneration or arthritis, disc problems, and conditions like stenosis where the nerve is getting pinched and they come in with a lot of pain into the clinic. And our goal is to help them to reduce the pain, improve the mobility, restore their posture, and get them back to doing the things they love to do again. So what is spinal stenosis? Well, stenosis is defined as a narrowing of the canal where the nerves come through. And that could be the spinal cord itself, because the spinal cord passes through the spine right behind where the vertebral body is. So there's the body of the vertebrae, right behind it is the spinal cord, and then there's the lamina and the spinous process right behind that. So that canal is very important. Sorry guys, that canal is very important because it has to have enough room for the spinal cord. And then between each vertebrae in the spine, there's a nerve root that comes out on the right and the left. And if that nerve root is narrowed, or if that nerve root gets pinched, then that can cause pain and discomfort. And that's a lateral stenosis of the spine. So there's the main highway, the spinal cord, and then there's the nerve roots, which are like streets coming out of the spine, and they need enough room to pass through as well. What is arthritis? Well, arthritis is defined as inflammation of a joint. So arthro means joint, and itis is a swelling of a structure. So in the case of osteoarthritis, that's when the bones start to break down or degenerate. And the bones break down or degenerate because they're out of alignment, the person has poor posture, maybe there's an injury, or they have an underlying condition where the joints are starting to break down and get arthritic. And sometimes I use the analogy of rust forming on the joints, that the joints starting to get rusty because they're not aligned properly, they're not moving right, and that can start to cause breakdown of those joints. So that's what arthritis is. And what is disability? Well, disability is when you can't do the things you love to do, whether it's work, going for walks, gardening, playing sports like golf. If you can't do those things because of a physical disability, then conditions like stenosis and arthritis can lead to that disability. So we really want to address those concerns and do what we can to correct the problem. So what can we do about it? We're going to talk about that today. And what is the plan going forward? I think to understand this, we have to look at the phases of spinal degeneration. So when someone comes in the clinic and they have normal posture, they have a curvature in the spine, front to back. Right to left, the spine should be straight down the middle, but we're looking at a side view here of an x-ray. So we're looking at the spine here from the side, and this is the front and this is the back. And so it should have a 42-degree curvature in the neck, the mid-back's approximately 60 degrees, and the low back 50 degrees. So we should see these curvatures, but some of them curve inward and some curve outward. And so when the person loses their curvature, the spine flattens, and that changes the physics on the spine. So basically, the head weighs quite a bit, and with gravity, it can put force down on the spine. And if the spine isn't curved and it's not absorbing a little bit of force or stress in each segment, it can get compressed, and then that compression can first affect the soft tissue. And that would be the discs, because they're like jelly donuts between the bones. And that disc material can get squished backward and forward. And if it gets squished backwards, that's where the spinal cord is passing through the spine. If it stays like that, and over time, over years, it can degenerate further to phase 2, where the bones start to get closer and closer together, less and less room for the nerve roots and the spinal cord. If it breaks down further, more material can start to interfere and impinge on the spinal cord. The cord has to take more of a circuitous route rather than a straight line. And so we start to get disruption of that integrity of the spinal cord and the nerve roots coming out of the spine. And it gets harder and harder to correct. And finally, phase 4 is when the spine is just kind of getting all squished together and it's not moving very well. And it can be accompanied by a lot of pain or discomfort and muscle spasm and rigidity. So we don't want to see that, because we really want people to be able to move and bend and flex. We want the spinal cord to be intact and that nerve flow to get through. And we know how important that is for the joint health, but the health in general. So the person's getting that power, that energy going from the brain to the cells, tissues, and organs in the body. And that's through the spinal cord and nervous system. So this process can take months to years to develop. And as a chiropractor, we want to catch this as soon as possible and correct it, because the faster we catch it and the easier it is to correct in general. And we want to be able to get the patient back on track and doing the things they love to do again. So when we look at the bones, these are the vertebrae in the spine. When I was talking about the discs are right here in between the bones. And then if those discs are getting squished, some of that material can press on the nerve root. This is the nerve root coming out of the spine. There's one nerve root on the right, one nerve root on the left side of the spine at each spinal level. And this can cause compression and then irritate that nerve. So you can get pain and discomfort, inflammation, muscle spasm, and it's all compensation for that misalignment in that area. As a chiropractor, what we want to do is realign these segments, open up the space for the nerve flow to get through, and then give the patient specific exercises and stretches to do to help maintain the integrity of the joint. Keep the joint space open so the nerve flow can get through, better posture, flexibility, and then eventually strengthening to keep the bones in place. We also want to advise the patient on nutrition. What can they do to heal the joint? So the joint's going to have inflammation. It's going to need some protein and collagen to repair the connective tissue. And so we want to talk about nutrition and good sources of protein so the patient can heal properly. And then we want to monitor their progress. So initially, chiropractic adjustments are necessary, but then eventually the patient can start to maintain the work we're doing in the clinic with some things they can do at home. If you're interested in becoming a patient at our clinic, we are accepting new patients here in Kelowna. If you don't live in Kelowna and you'd like to go see a chiropractor and you don't know one in your area, you can always drop a message in the chat or in the comments. We'd be happy to refer you to a chiropractor in your area that does this type of work. We do bill directly to insurance in the clinic, including car insurance. So if you've been in a car accident, we can bill directly to the insurance company. No referrals needed to come and see us. So you can come straight in, and we do provide a gentle, safe, and effective care in the clinic. We use hands-on chiropractic treatment as well as instruments. So more traditional and contemporary chiropractic methods, as well as we have digital x-rays in the clinic, shockwave, and laser. So these are some of the modalities we use in the clinic. If you want to book an appointment, you can easily go to our website. And I'm just going to switch over right here to show you the website and the upcoming events. So just bear with me while I switch screens here. And right here, you should be able to see my screen. And this is our website. And if you click here on this tab, what you'll be able to do is go to events. And on the events tab, you're going to see the upcoming events. Today's spinal stenosis and arthritis. But the other webinars we have are 5 tips to improve your posture. That's coming up next Tuesday. And then Coffee with Dr. Carey. We're going to have question and answer period on April 16th. So please join us for that on Saturday, a week Saturday, as we have coffee with Dr. Carey. If you want to book an appointment, go to drcareyurq.com, click on these 3 dashes, and then go to appointments. And when you go to appointments, you can just follow these simple instructions. Just click on book now, pick a day and time that you'd like to come into the clinic. We can usually see people within 48 hours. Pick that day and time, go to next, and then what you'll see is a place for you to enter your information, name and email, your phone number so you can get a text reminder of the appointment, the main reason for your appointment, and a coupon code. And right now, till the end of the month, we're offering $15 off your first appointment. So when you go to book, type in 15 off, and that'll give you $15 off for booking online. And then go ahead and book now. And we will send you the paperwork in advance so you can e-sign it. We'll send you a text reminder of the appointment and an email, and then we'll see you at the appointment. It's pretty simple. Lots of parking at the Landmark 4 between the 3 office towers, and we're on the main floor on the left-hand side. So thanks so much for joining me today. I hope you learned something about chiropractic, spinal stenosis, arthritis, and disability, and what we can do to help people to get back on track.